This is an ultrasound of a female aged 32 years, married, with a history of primary infertility. I have aligned the uterus with vagina, and what we see is that it measures approximately 13.7 centimeter in length, up to 11 is considered normal, and 7.9 centimeter. This dimension up to 5 centimeter is normal, so it's enlarged and significantly enlarged. Well, this is the urinary bladder, this is the anterior myometrium, this is the cervix, this area, this is the vaginal portion, and up to this region, then we will study further this area, up to this area, or say up to the half of the uterus, though the dimension is increased up to 7.2 centimeters, but the myometrium is seen normal in thickness. Here it measures 8.9 centimeters in this region, and measures 8.9 in this location. Now when I move this is the longitudinal section. As I move the probe to get the fundus of the uterus, I get this to see the appearance of the uterus. Now there are multiple cystic areas seen with a thin rim of endometriums surrounding it. Now this is the thin rim of myometrium. This is the myometrium at the anterior segment of the uterus. This is the fundal region, and this is the myometrium at the fundal region. And at the very same region, we see an area that is showing multiple cystic areas within. Let's see this area having an echogenicity that of the slightly more, it's a solid mass measuring approximately 10 centimeter by 7 centimeter, and there are multiple cystic appearing areas within all of this mass, which is being, now this mass is being surrounded by a thin rim of the myometrium all over. This is the fundal region, this is the anterior myometrium, and this is the posterior myometrium, this area from ear to ear, measuring 11.4 mm. Now at the very same region, when I'm going to apply the Doppler, you will see these are all vessels. So this is a highly vascular mass. Now when I remove this Doppler, we see just a mass. Okay, fine. And at this region, if you note, the myometrium is thinned out. So at places it's normal, at places it is thinned out, and it measures 3.9 mm at this location, anterior segment of the uterus, anterior wall, and it appears that as if this mass is showing areas of internal degeneration or necrosis, these areas. But when Doppler is applied, we see that both, see this is the venous vein, this is the arterial red one. If you could keep this far in view, so the vessels are not minute, they are of significant size. This is the transverse section of the same area. mass and the vessel. If you do see the velocity of this now the approximately 30 centimeter per second is the blood flow through this vessel that you are seeing, and this is the uterus in longitudinal section. This area is that of the fundus. This is the anterior segment, mid segment of the uterus. You can see the velocity if I get the vein as well as the artery together at some place I get it, then read the both here. This mass, which relates to the posterior segment of the uterus, extends up to the right lower abdominal quadrant on the right side. It moves this is the uterus, and then as I move it towards the right side, I get this picture. This is the whole of it. And these cystic areas are in fact the vessels within the mass in the uterus. This is and it is surrounded by a thin rim of this is the uterus again. In transfer section I am showing you now. See the vascularity. Okay. Now, having seen this, you will see small amount of fluid. This is fluid in the pelvic cavity, and not only that, you will see fluid in the Morrison's pouch and the hepatorenal angle as well. Here, this thin line, linear black line is the fluid in the hepatorenal angle. And as I move the probe downwards, I see this is fluid in the paracolic gutter, right side paracolic gutter. Here we are. And you will see bowels floating within it. This is the right iliopsoas muscle, this one, and this is the fluid within it. And then, as I move the probe downwards, I come across this large uterus with multiple internal cystic areas that are all vessels. So this is an aggressive nature of and this mass is of aggressive nature. Thank you very much.